Good afternoon, everybody. Thanks for joining me for another Chuck Chat. It's May the 6th. I am wearing my animal print. I didn't even know I had this shirt. It was in the back of my closet, so I've gotten a lot of compliments. Might have to add it to my usual wardrobe. Just to get started here, you should be able to see my screen. It's Mother's Day coming up, so happy Mother's Day to all of our mothers. I want to start off with a little humor as usual. So here's some mom humor. Stayed up all night with you when you were sick. Mom prayed for you, kissed your boo-boos, made your dinners, became your personal valet, and taxi driver went to your performances and photographed your every move, cheered you, championed you, and all you need to do is thank her every so often. And that's absolutely true. And in other news, sigh, I love you, Mom, just when it seems the world has lost its marbles. When we were making you breakfast for Mother's Day, but we have one question. How do you work this thing, fire extinguisher? Being a mom is a full-time job, and raising your kids can be hard, but look at it this way. If you hadn't had us, you wouldn't be getting this card. Happy Mother's Day. We wrote it ourselves. It's not easy being a mother these days. Texting in all caps just doesn't have the same impact as a good old-fashioned yelling. And that's absolutely true. See, I told you. So that's how she does it. It's a superwoman cape. Happy Mother's Day to super moms everywhere. COVID-19 in Westminster update. We have no active resident cases of COVID-19 at this time. All precautions and restrictions remain in place. This includes no visitors to our campus unless end of life or resident wellness, restricting trips to essential purposes, screening and temperature checks upon entering the campus, social distancing, hand hygiene, and masks. We have put some further healthcare center precautions in place due to the 5 COVID-19 positive employees, all in healthcare center. All are on isolation at home, and all are presenting with no symptoms. They don't have a temperature, nothing, runny nose, anything. We tested them because they had contact with a resident that had COVID-19, and those 5 people came back positive, but they have no symptoms. So as a further precaution, we tested all residents and associates being in the healthcare center. They either have been tested or they are being tested at this time. Excuse me. We have about 50 results back so far, and they've all been negative. So we'll continue all the precautions that we have in place in the lockdown healthcare center and quarantine as a precaution until all the test results come back. And we are coordinating with the Texas Department of Health and Senior Services and the Austin Public Health Authority as well. It is Nurses Week, so I thought it appropriate to play this video. Hopefully it works. I guess it's not going to. Oh wait, here we go. Nope. Oh, doesn't look like it's going to play today. I'm sorry for that. I tried. It played just a little bit ago. Let me see. Nope. Just not going to play for us today. Suffice it to say, it's a thank you to nurses. We have a great group of nurses here at Westminster. It's National Nurses Week, May 6th through the 12th. You know, if you get a moment, write a note and thank our nurses for the great jobs that they do every day. Send it to me and I can make sure that they get it. Give it to any reception desk and we'll make sure that the nurses get it. It means a lot to write a note. And then also it's being suggested by the mayor and many others around the country that at 7 p.m. this evening, we make some noise for our nurses. So, you know, step out on your balcony or maybe just open your window and applaud for them at 7 p.m. Bang on some pots and pans, just thanking our nurses and starting off Nurses Week and showing their appreciation. So I'm sure that they would all appreciate that very much. We love our associates. Make sure that you're, you know, thanking them for their service, which they're doing a fantastic job. Have to compliment all of them. and some of those associates are nurses, of course. We have about 45 nurses, I guess 40 nurses working on our campus during the week, and they just do a fantastic job, all of them, and you can see them in practice here. May 6th, questions and answers. Can you give us a status report on the pool? When will the pool be repaired? The pool heater has not been replaced yet. Residents may use in its current condition. The water will be cool. It will be repaired as soon as we receive the parts, which the heater just arrived this week, and we hope to have it installed actually tomorrow, but for sure by the end of this week. I had said by early next, but I honestly believe that they'll be able to get that done tomorrow. Any chance of having a real bingo? It is our intent to open up limited activities as soon as we can. Bingo will likely be one of the first to be tried with social distancing and mask in place. And that'll probably be done in Harris Bell Hall, where we can set up tables and make sure that there's enough distance between us, and then also employing masks in those activities. But likely to occur early because we'll be able to handle that ourselves with our own associates as opposed to having somebody come in from the outside. If we do that, it'll probably be limited to the outside for now. Why did the hair salon close down? When will it be allowed to reopen? They were closed due to warnings issued by the Texas Department of Licensure and Regulation and for increased precautions to prevent the spread of COVID-19. They will likely be reopened Friday as allowed by the governor throughout the state, and we'll have precautions in place, of course, as we have had. And we'll, if we need to, we'll introduce further precautions. What is the advice on outside haircuts? We've heard that in-house cuts are booked through July. I don't know that that's true, but if it is, we have more than one salon. So please just reach out to us. We would recommend that you stay on campus unless absolutely necessary. Our staff is well practiced in the use of personal protective equipment and all necessary precautions, unlike some salons. Please reach out to a receptionist if you have an unmet need of any type, including a haircut, and we will address. We have more than one salon and stylist on the campus, so keep that in mind. So just reach out to us and let us know. We'll see what we can do. Will phase 1 of the expansion work force a closure of the pool? If so, when and for how long? It is our intent to avoid closing the pool completely, and we will do our best to limit and mitigate any inconveniences that the residents will endure due to the expansion. We plan to keep the pool open. We may need to close during a few days that connection work occurs. That should be at the end of this phase of the project. So the end of probably 13 months, maybe 12 months. We will keep you informed of further details as they develop. But it's our intention to use the pool for as much as possible and to limit the amount of days that it has to be closed, and primarily doing the work as much as possible around the pool and just shutting it down, maybe a section of the pool or a section of the pool area to allow for connection. So hopefully we won't have to close it down at all. Are new residents moving into Westminster and during this time of staying in place? The short answer to that question is yes. A few residents have been moving in, all of which have been on our waiting list for years, some of them 4 or 5 years, and have been in process of moving in for several months. So a lot of them have made deposits with us on their entrance fee and have been waiting for an apartment for many months while we renovate it. We are restricting their movements around the campus using isolation and screening procedures and restricting who can help them move in and other things as well. But yes, we are allowing folks to move in. They've been wanting, we consider them part of the Westminster family. When will independent living residents be able to visit those in skilled nursing and assisted living? Unfortunately, I still can't give a definitive answer to this question. I hope to reduce restrictions to visitors in these areas in late May, but there are many variables that must be considered before we're allowed to do that, including the positive cases that we've had. Like I've said, no residents as of yet have tested positive, but we have had 5 employees in the healthcare center test positive. So we definitely have those precautions in place for a reason, and we'll release them or reduce them as soon as possible. Had some questions about an updated timeline on the expansion. This is what we think as of today. That we think is going to happen. It could change. COVID-19's made many things unknown, so there's a lot of variables in play. But as of today, June 20th, financing and the beginning of construction should occur in June of this year. If that happens in August 2021, we should be able to commence occupancy of the Windsor expansion units and the use of the new wellness area. So it's going to take about 13 months, right? October 2020, actually that should be 2022. I apologize for that error on the slide. Well, we should complete construction on the entire expansion. That includes the Carlisle building. November of 2022, we should commence occupancy of the Carlisle expansion units. The expansion memory support units achieve stabilized occupancy as well. March 2023, assisted living achieves stabilized occupancy. August 2023, skilled nursing rehab. So the memory support currently will be converted to a skilled nursing rehab, and that will achieve occupancy stabilization in 2023 of August 2023. And then December 2023, expansion independent living should achieve stabilization. And that's a date that I hope to outperform. I hope that it's much sooner than that. It was on the Windsor, and I expect to be on the Carlisle as well. Stay strong, stay safe. Thank you all. And I will be recording an expansion presentation. Unfortunately, I didn't get to do that yet. It's been a busy week, but I intend to do that in the next hour or so, and Ruth will play it when it's available. Thank you.